Hello everyone, welcome to Nidhya channel. Today we are here to discuss about some MCQs. So let's begin. So the first question is, the trachea is made up of how many C-shaped cartilage rings? And the answer will be 16 to 20. Now, trachea is also called as windpipe, which is the length is about 10 to 15 centimeter. And it is made up of the 16 to 20 C-shaped hyaline cartilage rings, and posterior of the trachea there is foot pipe, which is also called as esophagus, and in adult which is 25 centimeter, and in newborn it is 8 to 10 centimeter. Let's move to the next question. Endotracheal or tracheostomy suctioning should not be continued more than, correct answer is 5 to 10 seconds. Now, why we do endotracheal or tracheostomy suctioning? The answer is to prevent blockage by the ET tube while suctioning, and also to collect specimen, and also to increase ventilation. Okay, so now we should never cross 5 to 10 seconds while doing suction to avoid hypoxia. And the pressure of the suction should be 80 to 120 mmHg in the adult, and definitely you should pre-oxygenate the patient with 100% of the oxygen before applying the suction. And also remember that to apply the suction only while withdrawing. Let's move to the next question. Which nursing theorist developed the self-care deficit theory? And the answer will be Dorothea Orem. So the goal of the Dorothea Orem self-care deficit was total self-care. It means the nursing is needed when a person cannot meet their own self-care need. Now let's move to the next question. Which oxygen delivery device delivers the highest oxygen concentration, which is 90 to 100%? And the correct answer will be non-rebreather mask. So the non-rebreather mask delivers 90 to 100% of the oxygen, which is 12 to 15 liter per minute. Okay, so there is in which are the conditions we may use? The conditions are like emergency situations like trauma, shock, and then severe hemorrhage, severe hypoxemia where the SpO2 is dangerously low, and also if the patient is having carbon monoxide poisoning where the patient needs to have 100% of the oxygenation. During that time we will be using non-rebreather mask, which will be providing 90 to 100% of the oxygen. Now the next question is, the Braden scale is used to predict of the risk, I hope most of the people knows this, pressure ulcer or bed sore. So there are 6 parameters which are counted under Braden scale. Those are sensory, perception, mobility, activity, moisture, and nutritionist, and friction and chill. So now the highest score, the score limit range is 66 to 23, where the worst score will be 9 or less than that, will be counting as the very risk. Let's move to the next question. In snake bites, viper, viperidae.
Dream undi. Preparation ki direction kavali. Bro, I need proper guidance. కలలు కనండి.
ఈ రోజు మనం లెట్స్ ఫో గురించి నేర్చుకుందాం.
కలలు కనండి, సిద్ధమవ్వండి, నమ్మండి.
Join Nidhya Medical Academy and start your preparation now.
Venom has which effect? And the correct answer will be hemotoxic. So what happened with this venom is the clotting factors, there will be a failure in the clotting factors. The blood loses its coagulation capability, so the person has severe bleeding. Okay, so viper venom is hemotoxic, whereas cobra, crate are neurotoxic. Neurotoxic means what? The person will have paralysis. And also sneeze snakes causes myotoxic, which is the meaning is muscle destruction. And the vipers, the cobra venom also causes cardiotoxic. Okay, let's move to the next question. The next question is the compression to ventilation ratio for single rescuer adult CPR. The correct answer is 30:2. So this follows CAB method, where C is for compression, A is for airway, and B is for breathing, where the compression site will be the lower half of the sternum with the heel of one hand and the other hand will be supporting. And the depth of the compression should be 5 to 6 centimeter, also 2 to 2.4 inch in the adult, and the rate should be 100 to 120 per minute, which follows 5 to 6 cycles, and the ratio 30:2. Now when we move to airway, open airway, which is head tilt and chin lift method is followed. But if the patient is having cervical spinal injury, then we follow the jaw thrust method. When we move to the breathing, 2 breaths for a second. For confirmation of the breathing, you should check the chest rise. Next, move to the next question. Which type of the bleeding is characterized by the bright red spurting blood? And the correct answer will be arterial blood. So the arterial blood will be spurting or the bright red, which will be coming out as a shooting or the gushing out or sudden burst or like a jet spray, it will come out. And the venous bleeding, whereas venous bleeding will be coming out very steady and slowly. And then capillary bleeding will be the oozing slowly. Okay, internal bleeding is not visible or spurting. Let's move to the next question. Next question is, a nasogastric tube is measured from the tip of the nose to the earlobe to the answer will be xiphoid process. So this follows NEX method, where the N is nose, E for earlobe, and X for xiphoid process. So why we use nasogastric tube? Especially for feeding or administering medicine or for the drainage purpose. Approximately 45 to 55 centimeter of the each nasogastric tube it will be. For the adult, 16 to 22 fur, and for the children it is 10 to 14 fur, and for the infant it measures about 4 to 10 fur. Let's move to the last question of the day. The nasogastric or Ryle's tube should be changed every 7 days. Okay, so the nasogastric tube should be changed every 7 days, and the most complication of the nasogastric tube feeding is diarrhea. Okay, so while removing, avoid the pressure injury, and also while inserting, avoid intracranial insertion or maxillofacial injuries. Thank you everyone. We'll see you in the next video. Thanks for watching.